A long weekend ahead and more hospital closures are expected. It prompted a heated debate at Queen's Park during question period.
Over the last week alone, there were overnight and weekend closures at Chelsea Hospital, Durham Hospital, Walkerton and St. Mary's, which was closed for a week.
And now add Kemptville District Hospital to the list, which is south of Ottawa. It will close its ER from 7 p.m. to 7 a.m. for 6 nights until Tuesday morning. According to the Ministry of Health, there were a total of 21 overnight ER closures during the 2 weeks prior to this one.
How many ERs have to close before this government gets it?
And that's the exact reason we have to move the patients into long-term care because of the staffing crisis, because of the backlog surgeries, because of the long waits in the emergency departments. That's the exact reason.
Premier Ford used the ER closures to justify his government's new long-term care bill that passed yesterday. It will allow hospitals to push seniors ready for discharge into a long-term care home they may not want. In this statement, Kemptville's hospital CEO said the 6-night ER closure was due to system-wide pressures due to COVID-related absences, vacations, staff fatigue, and burnout. As for COVID, details were released today about the new version of the science table, which is being dissolved into Ontario Public Health. It will now be called the Ontario Public Health Emergency Science Advisory Committee and will have 15 volunteer members who will hold their first meeting in October. The team will continue to analyze wastewater data for COVID patterns. The Chief Medical Officer of Health was asked about the table's other work yesterday when he announced the 5-day COVID isolation guidelines were being dropped.
Will there still be projections that we saw the science table do to let us know what's coming?
That will continue, I believe that they'll continue to be transparent with that modeling process.
There have been concerns the new table will lose its independence. During the height of COVID, the Ford government did not always follow its advice, and the table made that clear. Under the new terms of reference released today, it states if they speak publicly, it will be through consultation with the PHO executive liaison. That could possibly mean the new version of the science table will have to get their message cleared through Public Health Ontario first. And Public Health will also have the final say on what the table investigates. One last thing to tell you about, the Ford government's budget passed today. That means there's one last big piece of legislation they want to pass before the summer session ends. That's the Stronger Power for Mayors bill. The Premier has said he wants that in place before the municipal election in October.